factors. Okay?
We know that one of the factors that drives mental health issues is gambling. 1 in 3 young Australians are gambling. Your government shelved long-awaited gambling reforms. Do you not fear that that will exacerbate the mental health crisis in the long term? And just if I can, you're the father of a young man. How important was it discussing mental health issues around the dinner table as he grew up?
Well, I prefer not to discuss my personal relationship with my son at a press conference, but obviously, in general, it is quite clear that young men and young women have issues that we need to talk about more. When I was my son's age, if I can say that, no one talked about these issues. We knew, I went to school with people who you knew, there was an issue there, but it wasn't defined, it wasn't acceptable. I well remember a friend of mine, not a relative, who was a young woman, a friend of mine's niece, who had an issue, ended up in RPA with an eating disorder. And that was really confronting. I was still pretty young at the time. I hadn't seen anything like that. She almost died. She is now well. She is now well and has children of her own. But that was really confronting, that occurred. And part of what today's about, and can I give a shout out to all of you for the way that you've asked these questions and engaged seriously in this issue. This is about helping people's mental health. This press conference is about that as well. Making sure that if people need a helping hand, they can put their hand up. And it's not something to be hidden, is so important. And that's why I spoke about Professor McGorry's role, because he, more than any other Australian, has made it acceptable, has changed the dynamic in the way that we discuss these things. When I talked with the parents, including one of the parents lives not far from here, when Charlotte lost her life, talking with Charlotte's mum, who bravely talked about this as well. It's one of the things that led to us taking the action that we have on social media. It's good that that is a bipartisan position in Australia. People might have seen the Time magazine article. That's good, because what that is about is saying to the world that once again Australia is leading the way, having the courage to show leadership and to get that support. So I think these are issues that we need to deal with. I'm really proud of this announcement. We've been talking with Professor McGorry, but our team going through the processes when we were working out our policies for this election. We were very clear that we wanted to strengthen Medicare. How do we improve GP services? But we want to do more than that as well. The urgent care clinics. But this announcement isn't an add-on. This is a central part of our health policy that we're taking to this election. Having been in government for one term, what you're able to do is to assess, okay, we've done some repair work, we've got better funding for hospitals, we've got the Medicare urgent care clinics, we're properly tripling the funding for GPs, but mental health is a really important part of that. There'll be some more health policy during this campaign as well, but I think this is critical.